Step into the illuminated darkroom where I shine a light on breast-related topics and beyond. I'm Dr. Ify McCurley, a general radiologist with over 20 years of experience in breast imaging. In this podcast, we'll explore the diverse and unique patient journeys, share insights, and empower listeners with knowledge. Join me as we dive into candid, real conversations that illuminate the path to better breast health. Hello, hello. How are you doing?
Good. How are you?
I am good. I am cold. It's coming down real hard here, but
And
it is
I
what
am
it is.
hot over here, as you can see by my fan. So I may
Yes.
fan myself from time to time, if you don't mind.
That's all good. It's all good. I have a blanket here too. So anyway, I have the absolute pleasure of having you here today. So I'm going to introduce you first with your bio. Dr. Jovita Oruwari is a board-certified general surgeon, a fellow of the American College of Surgeons, and a member of the American Society of Breast Surgeons. She completed her undergrad degree at Rutgers University in New Jersey, completing an internship and residency in general surgery at the University of Medicine and Dentistry of New Jersey University Hospital. She completed her breast surgery fellowship at Women's and Infants Hospital of Rhode Island, Brown University. She has been in practice since 2001 and has been voted one of St. Louis' top docs by her peers every year from 2007 to present. She's so versatile, and I would describe her as someone that does not fit in a box, which I absolutely love. She's an entrepreneur, an author, fitness and fashion enthusiast, a wife, a mom of 2 adult children, and more. She's very involved in her community. Dr. Oruwari is very passionate about breast diseases and especially breast cancer as it affects young women and African American women. I am so excited to chat with you today. Thank you for being a guest on the Illuminated Darkroom podcast.
Thank you. And congratulations on your podcast. It's an absolute honor and pleasure to be here.
Thank you so much. Well, if it's not obvious to my listeners, you are of West African descent, especially Nigerian.
Yay.
So I usually start the podcast by asking the meaning of your name. In your case, I'm going to ask you about you being from Nigeria, how you ended up here, family members, and the origin of your name, if you do know it.
Okay. So the origin of my name, first of all, Jovita. Jovita is actually not a Nigerian name. It's an English name. You know, we're Christian. We're from the Igbo tribe in Nigeria, and most Igbos are Christian. So when it came time to pick my Christian name, my mom wanted to have something that combined my dad's name because I'm the firstborn. His name is Joseph. And one of my uncles, Vincent. And somehow they came up with Jovita.
Okay, good.
And I've lived most of my life thinking that it was such a unique, made-up name. But I have since found other people with the name. And a lot of people with the name are of Latin or Spanish descent, where they pronounce it Jovita.
But interesting.
It's not that common, but it's common enough that there are lots of people older than myself and younger than myself with the same name.
Well, you're the only Jovita that I know, so. So you're unique and special to me.
Well, thank you. So that's my name. And how I came to be here is that my parents emigrated here in the 70s. Okay. And my parents came first to further their education. And when they completed their education, or when they were better situated here, they sent for my siblings and I. So I was about 11 when I came here. Okay. Here meaning New York and then New Jersey, where I grew up. And did most of my school in New Jersey, did my fellowship at Brown in Providence, Rhode Island, and then now settled in St. Louis, Missouri, where I've been practicing for over 20 years.
Interesting. Okay, awesome. Were your parents, were they studying medicine here, or were they in the medical field at all?
My mother is a nurse, and my dad's an engineer.
Okay, neat. The typical Nigerian family.
Very typical, yeah.
Very typical, yeah. And how many siblings? Sorry, go ahead.
Seven. I'm the oldest of 7.
Oh, okay.
Yep,
Big
five girls, two
expect
boys.
5 girls, 2 boys.
Yes.
Interesting. So I come from a family of 8. We're 7 girls and 1 boy and one bonus brother too, one adopted brother. So
Okay.
yeah, so
So
similar.
I know you have similar background from me. So did your parents have so many, not just because they're Catholic, but because they were shooting for a boy? Because that's what happened with my family. They were trying to get the boys, you know?
Yeah, no, they're not Catholic, but there's 4 girls that they had when they first were here. So they came with 2 and then they had 2 in Canada. I was the first one. So I'm number 3 in the line. And when they went back, um, my dad's family, they really wanted that boy. My dad didn't mind actually. He was
Yeah.
quite okay with, but there was a lot of pressure on him. And he was the only son of his
Hmm.
mom. And, oddly enough, some people in his family wanted to marry another wife for him.
Yeah.
And as if that would be the magical answer
Yeah.
to get the boy. So anyway, so they tried and tried and tried. And I got to tell you, I'm the third and I helped raise all my, a lot of my siblings. And I
Same.
don't remember when any of them were born, but I remember when that boy was born.
Yeah.
Like, you,
Yep.
you know what I mean,
Same.
right?
Same.
Yeah. It's a
Same.
big
Same.
to do. Yeah.
Yep. It is.
Anyway, so such is life. It's good to have daughters.
Yeah. I mean,
Yeah.
now they learn in their old age that it's actually better to have daughters, right?
Yeah, yeah. So do you remember growing up in Nigeria at all?
I do to some extent. When my parents came here, I was 5, maybe. And
Okay.
so between 5 and 11, I was raised by my grandparents. And I remember that because they were so dear to me. And being the first grandchild on both sides, I was a princess. I was loved,
Of course.
adored, lots of uncles, lots of aunts on both sides. So
Yeah.
it was, those were really special times to me or for me. And I remember it. Yeah.
Yeah. Yeah. Okay. Neat. And where in Nigeria exactly were you raised?
I was raised in Warri.
Oh, okay. Oh,
Yeah.
interesting. Okay.
Hmm.
Yeah. I was raised in Anambra State, Enugu.
Okay.
Yeah.
Yeah. I
So
was born in Port Harcourt, and
I've been there.
we lived in Lagos briefly. I think my parents came back during the war.
Mm.
That's where I was born in the east and then or southeast, and then after they left, my grandfather moved around with his company quite a bit.
Mhm.
So he settled in Warri, which is where I grew up most of the time.
Okay.
Hmm.
Cool. Now, speaking of your grandfather, I was going to ask you if there are any family members in medicine. So your mother was a nurse, and I know your grandfather, I'm not sure on which side one, then was a medicine man.
So that would be my great grandfather.
Your great grandfather, okay.
Yes.
That was
And
interesting.
it's one of the things again that I remember clearly. I don't remember a lot of my early childhood, but
Hmm.
I remember him. I remember sitting in his hut. I remember seeing him minister to patients,
Hmm.
doing the traditional medicines and making people well. So to
Hmm.
me, that's the earliest recollection of someone doctoring
Right.
with my great grandfather. And I think that probably shaped a lot of how I came to be or how I came into medicine.
Yeah. Interesting. Yeah. Now you came here. Obviously, you did your. I keep saying here. You're in the States. I'm in Canada, but anyway,
Yeah,
North America.
North America.
You yeah, you did your high school and I'm assuming junior in US, right, as well?
Um, yeah, I came into 8th grade and then went into high school.
Okay.
So it's always hard for me to kind of extrapolate the grade
Hmm.
equivalents, but I know that the the grade equivalent that I was in Nigeria was way more advanced than the equivalent here. So
Yeah.
I ended up being promoted twice.
Oh,
And
interesting. Yeah.
subsequently, I was younger than a lot of my peers by the time I was done with high school.
Yeah. Yeah, because in Nigeria we tend to use the British.
Right.
It's more advanced in here. Yeah, I totally know what you mean. Now, coming at that age, was there a culture shock? Do you remember at all, or did you assimilate pretty easily?
Um, I guess to some extent there was a culture shock. A lot of people ask that question as it pertains to the language, which was not a culture shock because we speak English in Nigeria.
Hmm.
So speaking English here was not a problem because that's what we spoke.
Right,
Um,
Queen's English.
the Queen's exactly. We spoke
Hmm.
the proper
Yes.
English. But by the time we got here, it was myself and two of my sisters, the three of us. My parents had three more kids. So
Okay.
so it was, the Nigerian children and the American children and just blending the family, meeting my
Yeah.
siblings. That was probably easier for me being that I was the oldest. I was the
Right.
oldest there. I was the oldest still here, but for my immediate two younger sisters who were
Hmm.
the babies, now no longer are the babies because there are truly other babies.
Yeah.
So there was a lot of that blending and getting used to for the first few years. There was a little bit of culture shock as far as the school and the
Hmm.
school system and um, just the ways that we learned in Nigeria was different from the ways that we learned here. Like I said, we're a
Hmm.
little bit more advanced there than here. And
Hmm.
then I think children are cruel. They are. They're really mean here. So
Yeah.
if you speak that proper English with an accent, they
Yeah.
make fun of you.
Mm.
And luckily, I've never really been anyone that I've never been someone that cared what my peers thought about me because I come from such a large family.
Hmm.
I had so many inbuilt friends at home that I
Yeah.
could care less. So it's always you go to school, you come home, you study, you do what mom
Right.
and dad want you to do. And so that didn't really bother me. But
Yeah.
if I was somebody that bothered, that would have been a real issue, I think.
Yeah, interesting you say that because I myself I came when I was 17 and I could speak English, but yeah, it's interesting you say that the accent.
Hmm.
And I know like even here Canadians don't think they have an accent, they do.
Yeah.
And I couldn't quite understand probably because of
Hmm.
the rapidity of how
Yeah.
they spoke and stuff like that. Yeah, but English was,
Yeah.
not a problem at all. Yeah. Now, how did you end up in medicine, surgery and breast surgery in particular?
So in med school, I liked most things. I There were some things that I absolutely knew I was not going to do, but I went into med school wanting to be a gynecologist. That was my interest. I wanted to do women's health even from a young age.
Okay.
Um, Going through the rotations in medical school, I did not love it at all. It just did not appeal to me. It didn't call to me in the way I thought it would.
Mm-hmm.
But when I rotated through general surgery, I enjoyed it immensely. I enjoyed being in the operating room. I enjoyed doing surgery. I enjoyed treating people in that way.
Interesting.
Um, so I knew that's what I wanted to do, but I was discouraged from all sides.
Mm-hmm.
Being a woman of color, this is not something that I was really encouraged to do, but it's
Mm-hmm.
what I really wanted to do. So going through general surgery residency, not easy, but about halfway through, I met a woman from East Africa who had breast cancer, who had a locally advanced breast cancer, actually. She was in this country by herself,
Mm-hmm.
and she was like in her late 20s. And that touched me in all sorts of ways.
Mm-hmm.
Just being a resident, taking care of her, I would go to her room, talk to her for, some time. And she had no one else, except me. And somehow that appealed to me so much that I thought that, I enjoyed doing breast surgery, but beyond doing breast surgery, I enjoyed the interactions that I had with her.
That
And I
connection.
found
Yeah.
that, yeah, that this was a field that I could do where, as a surgeon, you do an appendectomy, they're well, you never
Yeah.
see them again, or gallbladder removal, and you never see them again. But with a breast cancer patient, you're able to treat them and take care of them for the entirety of their life. Because my
Yeah.
patients continue to come back to me over and over. And you see
Right.
that with breast imaging also. You probably
Yeah.
see it with women that come in year after year for their mammograms. And I love that connection that I had with my patients
Yeah.
beyond the operating room. So that's why I decided to do breast surgery, and was lucky enough to have two female surgeons uh, in my um, in my town at that time
Hmm.
that were able to mentor me.
Yeah.
And
Nice. Yeah.
yeah,
Yeah. Yeah. I always talk about, in the breast world, that connection we have with our patients.
hmm,
Yeah, I just love it. It's like none other. And it's
yeah,
hard to explain unless you're in it, right? Yeah.
it
So
is.
I totally get that. Before I talk about where you worked and where you are right now, I want to talk a little bit about the insurance situation in the States. If you can
Hmm.
sort of break it down for me. And the reason I want to do that is increasingly we're seeing a lot of Canadians, or a few Canadians, that can afford it, go to the States to get treatment because of the wait lists here, you know? So, but in Canada, we have free healthcare,
Yeah.
right? So no one's going to be talking to you about insurance. We have screening programs. I don't quite understand what happens in the States. I have two sisters in the States, and they've sort of tried to explain it to me. It's very difficult for me to understand and wrap my mind, around the fact that if I want to see a surgeon, you're going to be asking me about insurance.
Hmm.
How does that work exactly? So many
Yeah.
questions.
And even having practiced here for all these years, it's still hard for me to wrap my mind around some things that happen.
Hmm.
For instance, I saw a lady in the office last week of just unfortunate case of a locally advanced breast cancer who does not have any insurance. She thought she did, but she didn't. This has been going on for over 2 years, and she's never seen someone. She's never even had a mammogram. And she presented to the emergency room because she had pain in her breast and some bleeding, and that's how they sent her to me. And she came to me, and I was seeing patients. I was in and out seeing patients and coming out, and I keep seeing her. She's still sitting there in the waiting room. It's like
Hmm.
an hour, and she's still in the waiting room, and so many patients have come and gone. So I was asking the staff, what is going on? Why is this lady
Hmm.
still sitting? And they said she does not have insurance, and we're
Oh
trying to
my
figure out insurance so she can see you because she can't
God.
see me. I'm like, oh my
Like
God,
I find out, it's
babe.
just, I can't believe it.
It's crazy. It's absolutely
Yeah.
crazy. Um, so most people who have a job have insurance through their workplace, where the company or whoever, like the hospital where I work for, they subsidize our health insurance. So if I needed to go see my primary care, or if I had an issue to go see a doctor, I'd present them with my insurance card. They'll take the numbers. They say little copay that I have to pay, with the balance is typically paid by my workplace. So if you imagine someone that does not have a job situation where they can be insured through their job, then they
Mm.
have to get their own private insurance. So if you worked for yourself, then you'd have to pay for all of it. And healthcare is very expensive, as you know.
Hmm. Hmm.
Um, a lot of people go bankrupt trying to pay for
Yeah.
healthcare. So if you don't have a job, you can go through either Medicaid, which is a insurance for people without income, to just the easiest way I know to explain it.
Hmm.
So maybe a little bit similar to national health care that you have in the UK and in Canada.
Hmm.
So that's Medicaid, which is paid for by the government, but they don't pay for premium health care. Um, it would cover you for some places, but maybe not all places. So you'd have to go to someone who is a Medicaid provider.
Hmm.
It's
Yeah.
complex.
So, when I think of disparity in the population in the States and Black people versus, well, is it any wonder? Really?
Hmm.
Like, yeah, that just breaks my heart.
Yeah.
It's hard to reconcile with that. And so that would absolutely make sense to me because, if you're thinking, oh, we're saying go get a mammogram, but you have to pay for it.
Right.
Yeah, that,
And if you cannot from you can some people really cannot afford it because they're trying to decide between am I going to feed my kids or
uh,
pay for my rent and keep the lights on in the house versus pay this X amount of dollars for a mammogram.
mhm.
It's hard. And those are hard decisions to make.
Yeah, absolutely. So in your work, because I know you used to work at a certain place and then you sort of moved.
I
Can you
did.
talk a little bit about that and what you've seen, what the difference is?
Okay. So I worked for a long time, about 15 years or so, in kind of the suburbia in my
Mhm,
town and took care of predominantly Caucasian women, wealthy women, women who have jobs and insurance, etc.
mhm,
And it was great. And I never really thought about any other different way to practice because people
mhm,
came in when it was time for their mammogram. They came in to see their gynecologist when it's time for their pap smears. They came in for preventative health, which
mhm.
is what, as a doctor, you want to see. So they were doing all the right things. You
Right.
get diagnosed with a breast cancer at stage 0, stage 1,
Mhm,
and it was fantastic. So around the pandemic, I transitioned from that hospital to the hospital in the lower income part of town. So my patients now are predominantly African American
mhm,
patients that are lower income and can afford, the traditional preventative health that we recommend to them. So subsequently, I'm seeing women who are coming in with more advanced diseases because they're not coming in for those yearly mammograms.
mhm,
Um, um, and we were just having to do a lot of outreach, a lot of community outreach to try to get to people where they are to try to help them come in sooner.
mhm.
It's such a stark difference to me. And it just really touched me because again, it's something, it happens, but
Mhm.
you don't think about it because it was not part of my everyday
Yeah.
life.
Yeah. Yeah, for sure. And yeah, I would definitely imagine that hugely contributes to the late stage, et cetera, in Black women. I mean, it's not just that, obviously, because in Canada, even though we have that free access, we still do see that as well. So there's obviously
Yeah,
more than that access to care, but having that access to care, I think it's so important. And
it's
it's
important.
just
Yeah,
unfortunate that that's not the case. Maybe one day.
maybe. I hope. I hope. We can only hope, right?
You can only hope. Yeah. Yeah. I never know. Right. So, anyway, so your focus, I found it particularly interesting, actually, breast pain and breast cancer in young women. And as it relates to pain, well, we see a lot of people with pain, right? Like
Mhm,
breast pain, Can
mhm.
you talk a little bit about what causes breast pain, what people can do, talk about vitamin E, evening primrose oil, all that stuff?
Okay. So, first of all, when I see a woman come into the office with concerns about breast pain, I want to reassure them because majority of breast pain is not going to be breast cancer. But for most women, they think once they experience breast pain, oh my God, I have breast cancer, and that's not the case.
Hmm.
Uh, Breast pain is very common. It's probably the most common thing that we see as breast surgeons. Women are going to have breast pain. Over 90% of the time it's going to be hormonal because of these estrogen hormones we have and these monthly cycles. And even without monthly cycles, there's still estrogen hormones that circulate and stimulate the breast and can cause pain and tenderness. So I like to get that out of the way and explain that this is more than likely what the case is going to be. So
Hmm.
beyond that, there are other reasons why somebody may have pain. Could be post-surgical, it could be scar tissue, It could be post breast cancer treatment, scarring from radiation, etc.
Mm-hmm.
Can also have breast pain from um, from caffeine stimulation. We're not
Mm-hmm.
quite sure how that works, but caffeine does not cause breast cancer. Let's make that clear.
Yeah.
It
Yeah.
can stimulate the breast and it can cause pain and soreness. So, for those women, one of the things that I would recommend is just try to either cut back on caffeine
Mm-hmm.
or cut it out altogether and see how you feel. And it's not
Mm-hmm.
just caffeine from coffee, it's tea, it's chocolate, it's
Right.
sodas. Sodas is a
Right. Right.
big
Yeah.
source of caffeine. So I'll have them cut that out. There's also pain that can be musculoskeletal.
Mm-hmm.
Some women from doing exercising, lifting, uh,
Mm-hmm.
maybe moving heavy boxes, moving furniture, may sprain the pec muscles behind the breast.
Mm-hmm.
And when that happens, that pain um, does last a long time because it takes muscles a long time to recover.
Mm-hmm.
But a lot of women that have that type of pain, the sensation is that the pain is coming from the breast, but it's actually coming
Right.
from the muscles behind the breast. And there's a way to do the breast exam to try to isolate the muscles to determine that that's where the pain is coming from. In which case, I would do ibuprofen, warm compresses, and that
Mm-hmm.
traditionally will get better over a few weeks. Um, but for women who have hormonal breast pain, I would usually first of all, I want to know, um, is this just natural hormones causing this, or are you on birth control? Are you on hormone
Mm-hmm.
replacement? Because that can also stimulate that pain. In which
Yeah.
case, cut it out or cut down on it, and we'll work with the gynecologist to see what's a better dose for pain. And I would sometimes recommend vitamin E, like you mentioned,
Mm-hmm.
and evening primrose, which has been found to help with some elements of breast pain. So we will trial that, and it works in my experience in about 60% of women will
Mm.
find comfort from vitamin E and evening primrose. So that's
Those
always part of
pills.
my arsenal of, try this, try that, and
Yeah.
one of those
Yeah.
things is going to work. Yeah.
Okay, interesting. Yeah. I was listening to something and I love that you said never dismiss anyone based on a negative clinical exam. And I just love that because it blows me away that still to today, we still see, previously we were taught if it's breast pain, it's not breast cancer. We know that's not the case, right? But still to
Right.
today, we still see people that have been dismissed because they have
Mhm.
breast pain. And so that is one thing I thought I wanted to emphasize, never dismiss breast pain. And you mentioned that you still recommend imaging, which I thought was
No,
such a,
absolutely, 100%. Anyone that comes into my practice with any kind of breast concerns, complaints, breast pain, breast lump, nipple discharge, um,
mm,
beyond my clinical exam, I always get imaging confirmation because,
yeah.
yes, I believe I have magic fingers, but
Yeah,
there,
it's always
there are
amazing
things.
what we find.
Yes,
Yeah,
there are
yeah.
things that my fingers cannot touch. I mean, even when sometimes it always like astounds me when a patient comes in with complaints about the right breast, and you could just go ahead and you image both sides, and you find something on the
The
opposite breast,
left
but there's
side,
nothing going
yes.
on. So yeah, I
Yes,
believe in imaging.
yeah, that's how I was taught. My mentors always said, if somebody comes to one side, you do the other side. Breasts come in pairs, you
Yes.
just don't just do one. And I can't count how many times I found
Hmm.
something on the contralateral side,
Same.
so you never know what brings somebody, you never know why, but
Yeah, you don't, but there's something. I mean, there's just something happening. Then yeah.
yeah, I
You
completely
just
agree.
want to rule out anything out of the ordinary. I mean,
Hmm.
to me, it cost us nothing to do it, so just
Exactly.
do it. It's
It's the
part
right,
of
it's a great opportunity. They're there. And yeah, yeah, exactly. Now, breast cancer in young women, I've heard it described as almost a different disease, like a completely different entity when you compare it to breast cancer in older women. What is the youngest person that you've seen with breast cancer and that you've worked on?
For me personally, it was a 19-year-old.
Oof.
Yeah.
Yeah, that's
hmm
hard.
Like
And
no family history, no
yeah,
nothing. Just out of the
yeah,
blue, 19-year-old.
that's crazy, right? And it still underscores the importance of breast self exam even in that young age group, right? In terms of breast cancer in that young age group, what challenges face younger people going through it? Dating, kids, fertility, how to navigate. If you can give some advice on,
Yeah,
what you've seen in your experience.
sure. I've seen all sorts of things, but yes, it's definitely a unique disease in young women because in your 20s and 30s, that's when, this is your fertile years. These the years when you are trying to get a partner, get
Mm-hmm.
pregnant, have babies, start a life for the family. So when breast cancer happens at this age, some of the unique challenges are how does the surgery affect my physical appearance? And
Mm-hmm.
even if you did not have a mastectomy, even just a lumpectomy with the addition of radiation, that breast is going to look different from the other side.
Right.
So there's lots of physical changes that
Mm-hmm.
make it challenging to a woman because part of our femininity and our attractiveness is our
Mm-hmm.
breast.
Yes.
So if you're not comfortable with what you're looking at in the mirror, it's
Mm-hmm.
going to translate to you thinking that a man or a woman is not going to find that attractive. So
Right.
that definitely affects a lot of how you think psychologically as a woman.
Mm-hmm.
So it's a lot of counseling that goes
Okay.
with that.
Right.
Um, Even for women that have had the mastectomy and have had reconstruction, I always
Right.
tell my patients that we're going to get them to as close to normal as possible, but it's not going to look like God made them. So there's
Mm-hmm.
still that discrepancy in the physical appearance, even after reconstruction, that's concerning for a lot of women. I have seen husbands and boyfriends that came at the beginning of the process with the
Mm-hmm.
patient, and by the end, they are no longer there because
Mm.
they could not handle it. So those are
Yeah.
definitely issues. And then fertility is a big one because a lot of what we do affect fertility,
Mm-hmm.
whether it's chemotherapy or putting someone on tamoxifen long term where you can't get pregnant, etc. So we also work hand in hand with the reproductive endocrinologist,
Okay.
um, where if we have time, we usually advise the patients to go ahead and have their eggs harvested and frozen so
Mm-hmm.
that later on, when they're ready, treatment is over, then
Mm-hmm.
the eggs are viable that they can then implant.
Mm-hmm.
Um, and that's also pricey here. I don't know how that is with you know
Yeah.
freezing
Canada.
your eggs in Canada, but that's that. But we have luckily there's some reproductive endocrinologists that for these pressure unique situations
Mm-hmm.
they do it almost close to free for these women, which is amazing.
Mm-hmm.
Yeah.
Yeah. Yeah, that's a good question. I'm not sure, but I would imagine that if it's associated with this situation, it's probably covered, but I'll have to look into that. I don't want to speak out of turn, you know? Yeah. Yeah, definitely a lot of challenges that young people face, but I hear a lot of counseling,
Mm.
right? They need a lot of
No, it's a
support.
lot. Yeah,
Yeah.
for sure.
Yeah. Working on a lot of, Black population, can you comment as to scarring? Do you see difference in scarring between people that are darker complexion versus Caucasian, healing, with keloid, hyperpigment, radiation therapy? Like what do you see? And
So everybody heals differently,
mm,
but there are some African American women and some Asian women that
mhm,
keloiding is unique to those populations where it's just a lot of keloid. No matter what you do with the incision, with the closure, uh,
mm,
they are going to keloid. And we can usually tell who that's going to happen to based on what other surgeries have you had in the past, or have you had a cut and how did it heal? So you can usually tell if they've keloided in the past, they're going to keloid again, even from doing a core needle biopsy, you would see the
Right.
scar from the core.
Mm-hmm.
It's like way more thickened than it should be. So there's some people that are prone to it, unfortunately. Um, every once in a while, if it's really bad keloiding, we can do the steroid treatments to
Right.
see if it would help, but it doesn't help everyone. There's just some women that have
Mm-hmm.
intractable keloiding that there's really nothing that you can do about it. But it is definitely common in some subsets of Black women and Asian women.
Mm-hmm. I really am hopeful that, in this world of technology that we're in, that there will be more advances, especially as it relates to lasers and
Yeah.
plastic surgery for our skin type, because that
Hmm.
is, I've seen some keloids and they're painful,
They are very painful.
Now, again, you see this, I'm sure you've seen the situation where you talk to people that have breast cancer and they're like, you know what? God's going to cure it. Have you come across that, and how do you handle that?
Ooh, with a lot of deep breaths, a lot of deep breaths.
Yes.
Yeah, because at the end of the day, everyone has autonomy,
Mm-hmm.
and I feel that my job as a breast cancer surgeon is to make recommendations and counsel the patient. So I give you information, and I want you to then use the information to make a decision and make the
Mm-hmm.
decision that's best for you. So I'm never going to push anyone one way or the other. I'm
Right.
never going to push you towards doing a mastectomy, having chemo, having radiation. But I am going to let you know that this is your best chance for survival, your best
Right.
chance for cure. And if you're a reasonable person, you'll accept those recommendations. And some people, uh, I won't say they're unreasonable, just based on their belief.
Mm-hmm.
They believe in a higher power that will cure, but I also believe in a higher power, and I believe that that higher power gives us the knowledge to be able to
Right.
make those recommendations. And it breaks my heart, honestly, because I've seen women, because I've been doing this for so long, that I've seen women that will come back 2 years, three, maybe 4 or 5 years later, who did not want treatment, and they were doing the rosemary water or whatever and
Mm-hmm.
prayers. And in 3 or 4 years, they have metastatic disease.
Yeah. I've
And
seen that. Yeah.
I'm like, why?
Yeah.
Why? I
I
mean,
know.
this was avoidable. I just have to let people do what it is they want to do. And
Yeah.
as long as I've given them the information to make the
Yeah.
decision that's best for them,
Yeah.
that's the best I could do.
Yeah. And I know you try hard. I try hard. I made a post and I said, there's so much talk about women and power, and we need to use that power to choose to come early, because you
Hmm.
don't come now, you're going to come at some point,
Yeah,
one way or the other.
right.
So why don't you come at a time when we can do the most for you rather
Exactly.
than later, right? So it's,
Exactly.
yeah,
Yep.
I see that, and it is heartbreaking. Yeah.
Yeah, it is.
Yeah. Now, I want to talk about like relaxers, bleaching creams and stuff like
Yeah.
that. I think to when we grew up, and man, we relaxed our hair and
Hmm.
burnt our scalp. And, you see so many people using lightning cream. And I kind of wonder sometimes,
Hmm.
do you think that that is somewhat associated with, you also not just talk about breast cancer, but endometrial,
Yeah.
gynecologic cancers as well. In my mind, and this is just me, I kind of
Yeah.
think there's got to be some sort of correlation. I'm just curious as to what you think. I know you have a sister that's a hairdresser too,
I
right?
do. I do.
Yeah.
So there is, I think to date, there's still no definite evidence except for relaxers with lye. Um, but I always worry about any type of chemicals. So personally, I have not relaxed my hair in probably 15 years or so.
Yeah, that's me
Just,
too.
just personally, I have not. And
Hard to say.
to me, it's almost like when you talk about hormone replacement, and hormone
Mhm.
replacement back in 2001, when all the research came out, it causes breast cancer. It causes breast cancer, so there was a drastic drop in using hormone replacement. And
Mm-hmm.
then more recently, the newer data is showing that, hormones may actually be really good for us. It's not that bad a thing, but
Yeah, it's changing.
it's changing. And it may be the same with relaxers. But to me, until we have solid evidence, I'm not going to relax my hair
Yeah.
and I'm not going to take hormone replacement for me personally. Yeah.
Yeah. Okay. Interesting. Yeah. Even with the hormones. Yeah. 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 I know. I just think there's so much. I don't want to say flip flopping, but you went to your conference this year, and
Yeah.
I was saying I can't remember exactly, but it's not diet anymore. It's smoking and all that
Yeah.
stuff. Like it keeps
Exactly.
changing,
Keep
and people say,
changing.
well, what do I do? I'm like, I don't know. Just be the best that you
Be
can,
the best
because
you can. Yeah.
you've seen it, like people
Yeah.
that are just the absolute best, plant-based diet, Iron
Yeah.
Man, Iron
I
Women
have.
athletes, they still come.
Mhm.
What's the answer? I don't know.
Right.
Right. So I just say, be the best you can, live a good life,
Mhm.
moderation and moderation. Right. And that's all we
That's
can do.
that's all. That's all there is to it. Yeah.
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 Mhm.
Okay. Now, one more thing about breast cancer in young women. How do you deal with that emotionally? It can get heavy sometimes. Like, do you
Yeah.
take it home? I know
Yeah.
sometimes I do, but it's not, some days it's crying, but yeah. So just curious as to how you deal with it.
you know, I try not to take anything outside of work.
Mm-hmm.
I'm really a black and white type of person where if I'm clocking out of the office at 5, I'm done, I'm out. Sometimes I may see my patients out socially and it doesn't even,
Mm-hmm.
I try not to. If I see them in the office, without even looking at their chart, I can tell you their name and what they had done. But
Right.
outside, I just, it's a block. They say,
Right.
I don't know what it is, but I'm
You're
just
able to
completely,
separate the two.
yeah,
That's
just
good.
completely separated because I feel that if I don't,
Mm-hmm.
it's going to incapacitate me.
Yeah.
And I don't want to do that. I want to be the best doctor that I can be to my patients in the office, in the hospital, in the operating room. And then I want to be the best me that I can be outside of the hospital. I
Mm-hmm.
want to be the best wife that I can be to my husband. I want to be the
Mm-hmm.
best mom, the best friend to my friends.
Mm-hmm.
Um, and if I take in all of my patients' problems
Yeah, it's gonna be
and
hard.
internalize it, I'm just not going to be any good
Yeah.
for anyone.
Yeah. No, that's right. So you make a concerted effort, and you have to, because
I do.
this is your day in, day out, and especially when you're seeing these people on a regular
Yeah.
basis, right? Yeah, you've got to do
Hmm.
that. Yeah. No, that totally makes sense. Okay. Well, let's switch a bit and talk about being a woman in medicine. I know, like that breath. I know. I feel that breath,
Yeah.
being a woman in medicine, being a Black woman in medicine, and the challenges you face. I have so many questions. And I listened to some podcasts you've been on, and man, it really resonated, especially being from Nigeria. We were raised, I think I was raised like you. Racism was not an issue.
Yeah.
Like we didn't talk about it.
Right.
And to be honest, if people were racist to me, it probably went over my head. No
Hmm.
idea, no clue, right? Life's going on,
Right.
right? Um, but yeah, I've had things happen that, to be honest, I'm still healing from,
Yeah.
right? And I just want to know, growing up here, in the sense that you went to high school here a bit,
Hmm.
did that help you in your residency? What did you experience in residency, fellowship, as a staff? If you can just kind of speak to that a bit.
Okay. So I have to say that while I was experiencing it, I did not know that that's what was happening. I
Mm-hmm.
think part of it is because we're so overworked in residency. And part of it is that I was not raised to think about racism. I was not
Mm-hmm.
raised to think that I was any less than anybody else. That's just not the way
Yeah.
my parents raised us. We were raised to be the very best at everything.
Right.
And, the whole Nigerian thing, somebody got a 99 and you got a 95. Why did they get 3 points higher than you?
Exactly.
Like, do they have two heads and you have, so
Yeah.
I grew up like that. So, I was always raised to be excellent. And
Mm-hmm.
that's what I've always strived for. So I've never looked at myself as that I'm Black
Mm-hmm.
and that I'm less than. That's just
Mm-hmm.
not part of the equation. But fast forward, because residency was horrible. It was horrible. And I did not even realize that it was that bad
Yeah.
until it took me about 10 years to go back to the program where I trained. And mind you, I grew up in North Jersey. My med school and my residency were in the same town. So I've had to go back
Mm-hmm.
multiple times every year to see my family because they still live there.
Mm-hmm.
But I would make an effort to go any which way but by my program.
Mm.
So about 10 years after I went back and I there was this PTSD that just overcame me.
Mm-hmm.
And it all just kind of started coming out. And I was talking to my
Mm-hmm.
husband who lived it with me that, oh my God,
Yeah.
this was a racist, misogynistic program. I went through all of it
Mm-hmm.
as a woman, as a Black woman, as a Black woman who became pregnant in
Mm-hmm.
residency. Yes, but I'm getting emotional thinking about it.
It's funny you say that. I am too. It gives me chest pain as you're
Yeah,
talking,
mhm,
and it is sad.
yeah,
You know, right now we're fighting for the guidelines in Canada to be down to 40, and we had some representatives, experts representing Black and Indigenous women, and one of the Black women, she talked about the social determinants,
mhm,
and one of them was racism. And if anybody would have told me that one day I'd be sitting here talking about racism, like let me put it into perspective for you. George Floyd, when that happened,
mhm,
I'd been married for 25 years.
yeah,
And someone said to me, "How does my husband identify?"
mhm,
And I said, "What do you mean? So how does he identify, Black or white?" And I said, "Oh, we don't think
right,
about that. We don't talk about that in our family."
right,
And I said, "But I bet if I go home and ask him, he's going to say he identifies as Brent."
uh-huh,
And that's exactly what he said. So
yeah,
people sit and listen and think, "Oh, these Black people talk about racism all the time." That was not me.
right,
I don't have imposter syndrome. I walk into a room just like you said, and I know I belong,
right,
but we can't avoid. I couldn't avoid what happened to me.
right,
And that has an impact, that chest pain, that
right,
emotional you're getting, right?
right.
And it's heartbreaking.
It is.
And I wish it
It,
wasn't so.
I wish it wasn't so. And yeah, but
Mhm.
it happens, and I mean, and it continues to happen,
Mhm.
unfortunately. But I think the best way, and I was talking to someone else about it, and I just said, the best way to overcome it is just be the best
Mhm.
doctor that you can be the best at whatever it is that you can
Mhm.
be, so that there's no question as to why you are there, as to whether you belong or not.
Mhm.
You just
Yeah,
have
because
to,
we're gonna excel.
yeah.
Yeah. Yeah. I don't know if you know who Matt Walsh is. He's got this movie, Am I Racist? And I look at it, it's like I just want to sit down with Matt Walsh one day and have a conversation.
Hmm.
Just live a day in my shoes and see what
Yeah,
it's like.
absolutely.
But to
Yeah.
that effect, I do want to mention something amazing, that you are an author of this book. Black
Yeah.
Girls in White Coats.
Right.
And I thank goodness for audio books, Apple. I listened to it all.
Thank
Okay.
you. Thank you.
I did. And I felt like, first of all, you know that chapter, I think it was track 2, where the narrator, she listed all those names. Man, I was like, I gotta clap for her. Because when you listen when you listen to it, and she's listing all these names, all 60 of them.
Yeah.
At the end, I was like, hello.
I
That
know.
that was pretty incredible, right? Yeah,
Mhm.
yeah. So, but I love all the challenges that essentially pretty much everyone you spoke to went through, and they rose above, you know?
Hmm.
I was struck by some people who were told, just like yourself, to not continue their training, but they went on to finish, and not just finish, but they made a mark. Those that, persisted, one of them took the MCAT up to 5 times.
Mhm.
Admissions officers saying you're not going to make it past your first year.
Yeah.
You yourself, you said you had the audacity to choose a specialty where you were a double minority, a woman, Black, and a foreigner to boot, and I was thinking, what's wrong with the derm specialty? Derm has a lot of issues, man. Like dermatology, you know?
And that's the specialty where, as a person of color, if you have a skin issue, you should see someone who understands your skin,
Yes.
right?
Yes. Yeah. Yeah. Anyway, there were just so many strong no's and so many things that could have been an obstacle. And these women, it was just amazing,
Yeah.
And
yeah.
yeah, like people that didn't take no for an answer. One of them, I think it was Dr. Michelle Ogunwale, intimidation. Like if I had a dime for each time I was told I was intimidating,
Yeah.
And she said she shrunk herself to survive.
Mm-hmm. Mm-hmm.
And I hope if there are any young girls or just women in general, you don't even have to be a Black woman just listening to this.
Right.
I want them to get this book and listen to it because it's so empowering.
Mm-hmm.
And it would, I just thank you for doing that. Like, I'm sure it took so much work for you to put that together.
It did, but I think it was worth it in the end. It was worth it for the feedback I'm getting back from young women. I'm just hoping that it does what I wanted to do, which is just empower and encourage more young women of color to pursue health fields.
And to stay in it.
It's a need. Yeah, and to stay in it, yes.
And to stay in it. Like, it's not just for people that aren't coming in, for us to stay in it, to persevere, and persist. Like, because we need to do that for the people. I think I need to do that for my children.
Yeah. Yeah.
Right? And for the people that are looking at us.
Yeah.
Yeah. Yeah. So I thought that was Black Girls in White Coats. If you're listening, you definitely need to go get that. Like, you did an amazing job there. Yeah.
Thank you.
Awesome.
Thank you.
Yeah. So I just want to talk about your family for a bit. You had 2 kids in residency. Hello. What were you thinking?
I don't know. But we knew that we did not want to be in our 40s having babies.
Yeah.
We knew that. So we just
tough.
Yeah.
How did you manage that? I mean, I had one, my first daughter in residency. She was not planned, mind you, but
Yeah.
It's what it is. How did you manage? How did you cope? Help?
We had help. We're lucky enough to have, his mom actually came from Nigeria and she moved in. And
good.
Yeah. And took care of the kids while we were training. She did that both times for about 1.5 years, 2 for each kid.
Oh, nice.
And I don't think we could have done it without her doing that, because those first few years, I don't know that I would have been comfortable leaving the kids to anyone else,
Yeah.
So
family is important.
We were lucky to have that.
Yeah. I love, like, your husband's in medicine as well. I can't even imagine what it's like living with a psychiatrist. That's probably a whole other situation. It's working because it's 29 years, right?
Almost 30, yes.
Almost 30, yes.
30.
So something's going on really well there, and I loved seeing you and your daughter when you went for that conference.
I know.
That was so awesome.
That was amazing. That was just, I mean, that's what it's all about, you know?
Yeah. Yeah.
It's
Yeah.
just like
100%.
that was a full circle moment.
Yeah. What is your son studying?
Engineering.
Okay. Look at that.
Biomechanics, yes.
Okay. Nice. Nice. Okay. Well, that's good. I think we've touched on most things. Do you have any final words? Anything we want to add?
No, it's been a lot of conversation today.
Yes, yes. I was so excited to chat with you because this is a rare opportunity,
Yeah,
and
you as well. Thank you.
where can people find you?
Okay, I'm on Instagram.
Say it all. Say it all.
Okay, I'm on Instagram. I'm just starting this whole TikTok thing. I was convinced at that conference 2 weeks ago that I needed to get on TikTok, and I'm just kind of dabbling into it. I think I have like 2 followers right now, but I'm
going to follow you. So tell us. I'll put it in the notes.
Yes,
Where
I'm trying to do that. So Instagram, TikTok. I have a website which I need to do more on because I write blogs that I post on there. So drjovitaoruwari.com.
Mm-hmm.
And the information about the book is there also. And the book is also available on Amazon.
Okay.
And I also have a home fragrance company. Christmas coming up.
Bloom Aroma, right?
Ugo Bloom, yes.
Yeah. Girl, I got you.
So, yes, just candles and diffusers and things like that, just home fragrance type stuff.
Okay, I'm going to check it out because I love candles.
Oh, good.
Yeah, I got them
good stuff. Yeah,
every day. Yeah. Okay. Well, that's awesome. And you're in St. Louis, Missouri.
Missouri, yes.
Right. If anybody, because you never know, if you want to come and check you out, and if they ever need your services, then that's where to find you.
That's where to find me, St. Louis, Missouri. Yep.
Okay. Well, thank you so much. I want to end it this way. I really resonated with, there was a Dr. Magdalena Cadet. I don't know if you remember her.
Dermatologist, yeah.
Yes. What she said a lot of the things she said really resonated with me. And she said to young people, love yourself, know yourself, your strengths and the aspects of your personality that you want to work on and improve. Always be grateful for the people around you who want to help in any capacity. It can be your parents and friends, the janitor in a hospital or office, the receptionist, the teacher, anyone. You are unique. Embrace those gifts you have and improve someone's quality of life. Help others. It will make you feel so wonderful. When you fall, you must continue to get up time and time again. You can do anything if you believe in yourself. There will be obstacles and people who want to dim your light. Do not let them. Be kind. The world needs more kindness to flourish. Speak up. If you see an injustice or experience one, you must say something. Your voice matters. Someone will eventually listen. Be persistent no matter how defeated you feel. Keep going and show up every day. You have so much to offer the world. You don't have to follow a traditional pathway, so it's okay to think outside the box. And for any physicians listening, someone said it's a privilege that we're granted into patients' vulnerable lives every day. And it really is a privilege. And so with that, I want to thank you and my listeners for being here. I am 100% sure that we're going to meet in person someday. And I am so thankful that you're here.
I hope we do.
Yes, we definitely will. So thank you so much. And I can't wait to post this and for people to listen. It's amazing. Thank you.
Thank you so much. Thanks for having me. This was great.
It's my pleasure. Thank you for being here.
Most definitely.
Thanks for being a guest on my podcast. And to everyone that's listened, a huge thank you to you as well. I look forward to sharing the next episode with you. Please follow me on my social media platforms at Dr. Ify Women's Health for upcoming episodes and more. Please note that the discussions and opinions shared in this podcast should not be considered medical advice. If you have any concerns or symptoms, please consult your primary care physician.